Coming right up, a special edition of Straight Talk on SCAN Health Plan. Our guests tonight, SCAN CEO Chris Wing and SCAN Medical Director Dr. Ramla Batra, as we continue our 23rd anniversary year.
Straight Talk is brought to you in part by the Port of Long Beach, a leader in international trade and environmental stewardship. And the Press Telegram, your local news leader for over 100 years. And SCAN Health Plan, for your health and independence.
Join us for tonight's edition of Straight Talk. And now your host, Art Levine.
Good evening and welcome to Straight Talk. We have a great show for you tonight, focused on SCAN Health Plan. Our first guest is the CEO of SCAN, Chris Wing. Chris, welcome back to Straight Talk.
It's a pleasure to be here, Art.
SCAN is still going strong after almost 30 years.
We're having a field day. Things are really good. Matter of fact, this year, Art, well, actually 4 years ago when I came on this show, we said that SCAN wanted to be the best Medicare Advantage plan in the universe.
Okay.
Not measured in profits, not measured by size, but measured by member satisfaction. And this year, we caught Kaiser. We're not the best yet, but CMS does a survey. Kaiser's got 91% satisfaction. SCAN's got 91% satisfaction of our members. So nobody's better than SCAN.
I love it. Congratulations, because you're a non-profit, and so you don't have the concerns of return on investment and all that kind of stuff. So your focus can be on the welfare and benefits to the members. We're
owned by the members. They're our primary stakeholder.
A lot of people don't know that SCAN was actually founded right here in Long Beach by so-called 12 angry men who were not happy with the quality of the health care they were getting as they approached senior age.
You know, our story couldn't be any better. You couldn't write a story as our SCAN story, because we were founded in 1977 by 12 angry seniors who weren't happy with the care being rendered to their fellow seniors, especially how many of them ended up in nursing homes. Ergo, SCAN's mission today and 38 years ago is very simple, very elegant, helping seniors stay healthy and independent.
And I know it's very personal to you because years ago with your dad, you saw what that all meant.
My father spent the last 4 years of his life in a nursing home.
Yeah.
And when you can keep anybody out of a nursing home,
it's God's work.
God and the angels ring bells in heaven celebrating that.
Well, let's consider a couple of the new areas of expansion. And you don't expand just for the sake of growth. You expand where there's a member benefit to that expansion. New counties in 2015.
In 2015, we entered Napa County and Sonoma County.
Ah, you want to be near the wine.
Well, maybe. But I think the expansion went very well, exceeded our expectations, our response from the marketplace. I think we're up to like almost 4,000 members the first year. So wow. A not-for-profit, mission-driven company like SCAN, you know, our time has come. The market needs more companies like SCAN.
How do you decide which counties to go into? What's the calculus for that?
Well, we always want to make sure that we have a chassis of a medical group that can really perform well as far as satisfaction, quality, and making sure that we keep healthcare costs affordable. Yeah. And then we slap the SCAN chassis on top of the Metagroup chassis. Yes. So without a strong medical provider, we wouldn't go into the county.
You wouldn't just go in solo.
Gotcha. We don't do solo.
And you've formed an alliance with Cigna. Tell us about that and how that benefits your members.
Yeah, we're very excited about that. We worked on this with Cigna for almost 2 years. And basically, the real value proposition for the market is so many of the companies that offer long-term care insurance nationally, they're not doing it anymore. And there's so many seniors who live by themselves, so many seniors with disabilities, that a lot of seniors just live in fear of ending up in a nursing home. So we provide home and community-based services to our members, probably as good or better than anybody else. So now with the Cigna Alliance, for employers who sponsor Medicare Advantage plans like SCAN, we can offer a product that offers home-based services. Yes. So that members who have disabilities, we can give them the comfort and the support so they can stay in the community and not worry about ending up in a nursing home.
And of course, Cigna is a major entity in the healthcare field.
Yeah, they're a market cap of $34 billion. They're a big company.
Talk a little bit about the duals, the connection contract. I know you got awarded by the state another contract. Congratulations.
Well, since I got there, it was 1 year renewal, 1 year renewal. In 2015, we got awarded a 3-year contract. Again, we're in Los Angeles, Riverside, and San Bernardino. And I think, based upon the May data, we're the fastest growing dual plan.
Just
in
for the
those
record,
counties.
dual means Medicare, Medicaid.
We take both the streams of Medicare and Medi-Cal.
And so dual eligible are those that qualify for both.
For both, yes.
And the member satisfaction you mentioned earlier, 91%. Congratulations. That must be very, very powerful to you personally and to the organization.
Well, I couldn't be prouder of our system, our board, our employees. But we set out 4 years ago, Art, to be best. And there's that little company that starts with a K.
Well, yeah.
That does a fantastic job. Kaiser does a fantastic job, but we're not best yet.
They were a pacing horse for you.
Yeah, that's the ticket.
And there you go.
They're the rabbit, but they're a very good rabbit.
Yeah.
But we're not going to be satisfied until we're the best.
Well, healthcare is so precious to so many and so important.
Sure.
And to be providing a quality healthcare and being recognized by the people you're serving with that is very meaningful.
I think our employees are very, very proud of this accomplishment.
Okay, in the next segment, we'll be joined by the medical director of SCAN. Stay with us.
At the Port of Long Beach, we're not only delivering jobs, smart ideas, and forward-thinking environmental initiatives. We're also delivering opportunity for all of Southern California. Oh, and a clearer horizon line. To learn more, go to POLB.com. The Port of Long Beach, thinking outside the docks.
At Performance Plus Tire, you'll find we carry Toyo tires. For over 50 years, Toyo has been a world leader in the development of high-quality tires. Optimum performance, safety, and a comfortable ride. That's what makes Toyo tires great. And now come into Performance Plus Tire for a great deal on these Toyo tires. Proxys ST, Open Country AT, and Proxys 4. Toyo tires, driven to perform. Come in today and we'll install new Toyo tires on your vehicle while you wait. Performance Plus Tire on Cherry Avenue, 1 mile north of the 405 in Long Beach.
We're back, joined now by the medical director of SCAN Health Plan, Dr. Ramala Bachar. Doctor, welcome to our show.
Thank you so much.
Tell us what you do.
I work at SCAN, and my role is to oversee that our members get the best quality of care that is possible and the best outcomes that's possible, and at the same time keeping our mission going strong and healthy.
And so you are responsible for the interaction with hospitals, with physician groups, with physicians, and with pharmacists.
Absolutely correct. We see each one of them as a very powerful stakeholder as they touch our membership. So we interact with our pharmacies, we interact with our physician groups, we also interact with other entities like home health companies, so that we always keep our members in the center of it all.
I was struck when I was reading the materials you sent in preparation for this, that the entity with whom members have the most interaction are pharmacists. Tell us how that works.
Yeah, so it's very interesting. You would think our seniors would be seeing a primary care physician 6, 7, 8 times a year. But what we found when we looked inwards is they're seeing a physician maybe twice a year. However, what we noticed was they're seeing a pharmacist or going to a pharmacy 19 times a year. Wow. And so that was a very powerful message for us, because it's coupled with the fact that pharmacist happens to be also one of the most trusted professions in the country.
Almost as much as lawyers.
I hope not.
Just joking, just joking.
I hope not. Almost as much as physicians or police officers. And so for us, it was an aha moment to say, how can we leverage that relationship so that we can improve our overall outcomes and improve the experience for our members?
So Chris, now, knowing that, you've made some adjustments in what way? Now that you know that pharmacists are that key contact point.
4 years ago, we started identifying that Medicare Advantage was getting tougher because of the rate decreases coming down the pike. And for us to continue to offer affordability and to improve quality and improve service, we need to work closer with our providers. We have a project called Provider Integration, where we work with 14 of the best groups, in California and Arizona. But we did identify that members present themselves to our member services maybe 3 times a year, to doctors 3 times a year, but they're presenting themselves to retail pharmacists 19 times a year. Every encounter with a member is an opportunity to improve quality of care, to improve service, and improve affordability. So now we're working very closely with our pharmacy benefit manager. We're talking to all the retail pharmacies about how can we take this data and provide better care, for our members.
And as you get older, the possibility of wrong dosage or improper increases, and I know that that's a problem in the medical field generally, and by focusing on that interaction, you probably can reduce the incidence of misuse of the prescription.
I think they're called adverse drug events, but Dr. Botro?
Adverse drug events. That's
ADEs. We have a new acronym.
A new acronym. Okay. Tell us about that.
So what we find in our population is members sometimes do not realize they may be taking 2 of the similar kind of medications because they were in the hospital, they got an extra prescription. So that's where our pharmacist's role steps in, because not only are they looking at quality of care, they're also looking at safety, that they're taking at the right dose. For some people it seems easy, take this medicine twice a day means you take it every 12 hours. Yes. But sometimes it's hard for members to get a grasp of it, especially if you have recently been discharged from the hospital.
So they take 2 at the same time?
So they may take it with 2 at the same time, take it 2 at 6 hours. So that's where our pharmacist proves to be very, very helpful. Plus, if we look at it, affordability is a very big deal for our seniors.
Yes.
And that's where pharmacists can step in and advise our members, hey, you're on this medication, there's an equally efficacious generic medication, which has very low or no copay, that does equally effective job and saves a few dollars. And what has been shown in studies is when people take those medications, they stick to it because they can afford it, they have better adherence and they have better outcomes.
So that's a win-win for the system and obviously for the patient. Is that related to the Express Scripts program that is referenced in your materials?
That's absolutely correct. Express Script is one of the biggest pharmacy benefit manager in the country. And so what we have done is we have partnered with Express Scripts, and they in turn have partnered with retail pharmacies like CVS, Walgreens, and Rite Aid, where most of our members go to, so they can better leverage those kind of programs.
Well, I know I go to Rite Aid to get mine filled, and there's a couple of lovely pharmacists there, and they explain to me what it is, and they give me some written materials, and they're very, very good. And you're depending on them. You see all those things up there, and they make a mistake. If I make a mistake, maybe the segment looks bad, but if they make a mistake, someone can die. And so you really do place a lot of trust in your pharmacist.
Absolutely.
So these benefits, though, go beyond just the members of SCAN. Explain how that happens.
So once again, our mission is to make seniors healthy and independent. And when we say seniors, it's not SCAN seniors. It's all the seniors that we directly or indirectly touch. So what we have done is we have taken UCLA, which is one of our premier academic institutions, and asked them to identify best practices around certain conditions within our communities, within our medical groups. And then we have taught other medical groups how to adopt them. So not only are they providing high quality care to SCAN senior membership, but they're also providing high quality care to other seniors that they may kind of take care of. So we feel that our footprint as in touching the seniors is beyond what SCAN members are. So we're very excited about that particular project. And as many of your audience people may know, our seniors are suffering from a lot of chronic conditions. Yes. So we focus on people who are frailer or who have a high number of chronic conditions so they get the best care possible.
One additional, Art, on that is that we see our responsibility being beyond the 170,000 members we have. So this work we're doing with UCLA, which Dr. Batra mentioned, we're hoping to get published. So when we find a best practice when it comes to seniors who have disabilities, seniors with multiple chronic conditions, seniors facing end-of-life decisions, we want to come up with identify better practices, get our existing groups that take care of our members to adopt them, but also publicize them so anybody across the country can replicate them.
So SCAN's mission is not just to provide medical benefits to their members, the 170,000, but to help seniors generally with their medical situation.
Our board and this team is committed to making our legacy, our footprint, if you will, be well beyond our enrolled members.
And in the next segment, we're going to talk about the independence at home, which is exactly that. So, Doctor, thank you so much for visiting with us, and continued success with your work.
Thank you so much, Art, for having us.
Thank you. And we'll be back with the rest of our show after these messages.
How do you like your chances the rest of the way?
I got no idea. But I do know that if we stay with Naples Rib Company, at least we won't go hungry.
Coach, what do you think about some of those questionable calls tonight?
Oh, yeah, but if you want a sound call, I'd call Naples Rib Company. You can't miss on that call.
Then Naples Rib Company is part of your game plan?
There really is nothing more motivating than a great barbecue meal at Naples Rib Company.
Victory or not, Naples Rib Company, great game plan.
Founded in 1976, Polly's Gourmet Coffee is Southern California's most complete gourmet coffee store. Polly's has the best tasting coffee, freshly roasted every day right in the store, plus a wide selection of teas, an in-house bakery, espresso bar, patio dining, and more. We also offer Wi-Fi, free internet access for all of our customers. Our nationwide clientele agree when it comes to coffee, there's only one name to remember, Polly's, 4606 East 2nd Street, welcoming you into Belmont Shore.
When I was a boy growing up in Italy, I had a dream to own my own store. I came to the United States and I worked hard as a tailor. Hi, I'm Umberto. I've been in Long Beach since 1960, carrying the finest quality men's clothing. Italy's a long way away, but styles are just around the corner. Umberto, 2141 Bellflower, Long Beach.
When you have enough internet speed for everyone in your home, Mom can video chat with Grandma. Your daughter can check her favorite sites. Your son can conquer the galaxy, and you'll still have enough bandwidth to conquer your first warrior pose.
I'm all right.
As you further energize your back,
Get internet speed starting at 60 megabits per second with Charter Spectrum. Where will it take you?
We're back with CEO Chris Wing of SCAN Health Plan, and in this segment we want to talk about the Independence at Home program. Tell us about that.
Well, 4 years ago when I got to SCAN, I went to a little facility that I think I was the first CEO to visit, but it's been around since our inception in '77. And I started talking to the leadership and the team, and they started instructing me about all the great things they were doing, keeping seniors healthy, keeping seniors independent.
And these are non-member
These are
seniors.
non-SCAN members. Again, our footprint is, it has been, we want to serve members beyond the members we enroll. So 2 years ago, we had a discussion with our board, and our board said when they heard all the great programs that Independence at Home was doing, for instance, volunteer action for the aging, going out and connecting seniors with the community, doing grants, our safety net providers out there who have historically provided care like Meals and Wheels and so forth to seniors, they're facing severe, budget cuts.
Sure.
So we decided, our board decided, let's invest $5 million a year to go beyond our footprint, to expand the footprint of SCAN and invest that with Independence at Home to do more stuff to help seniors stay independent and keep them healthy in the community.
Well, that can only benefit Long Beach, where you're based, but I know other communities as well. Let's take a look at a short clip of one senior who had remarks to make, and also remarks from the director of the program.
It's an awful thing to think about having to be somewhere where you'll be stuck in a bed or in a room where you don't do anything except what somebody else tells you to do.
Independence at Home is a community-based organization where we have been providing for 37 years services to seniors in our community so that they can remain at home and not find themselves institutionalized.
So, Chris, we saw Denise Leiker, the vice president in charge of the program, in that clip. So let's go through a few of the programs: grants and community giving, community education. I mean, education is so important. Things that people can do themselves to improve their health.
Self-education. And again, a lot of the traditional providers of education in the community have had to stop their programs or significantly reduce their programs.
Yes.
We're a not-for-profit. This is part of what we should be doing as a not-for-profit, but it also speaks to the heart of SCAN. So again, we have the volunteer action for the aging, and a lot of seniors don't have a lot of connectivity, so we want to connect them to other seniors, to other programs, so we can reduce isolation.
And health screening can be very important.
The best diagnostician of people's health is themselves. So we can teach them how to observe their healthcare status and let us know, or let their primary care physician know, if there's any erosion. We want people to become a partner as far as maintaining their health.
And technology is so dramatically improving opportunity with a watch now. You can get your heartbeat and everything else, telemetry, and probably we ain't seen nothing yet about the use of technology for diagnostic.
We're very proud of SCAN, and I think we do a great job as far as for the seniors who are eligible, getting in the home with our caregivers, with our social workers. But the whole field of connecting the home technology is expanding. And so I think in the next 4 or 5 years, when I come back in 4 or 5 years, or if you invite me back, I think we'll be able to talk about, wow, look at what we're doing to connect seniors with other seniors, to connect seniors with a primary care physician, seniors with their caregiver, seniors with their family, seniors who may be in Long Beach, but whose mom or son or daughter are in New York.
And this volunteer program, I mean, human contact is, I'm sure, very important to people in that stage of life, as it is at any stage of life. So you get volunteers to interconnect on a personal basis.
Actually, one of my favorite programs that just magical to watch is, and it was featured on a local radio station about 4 or 5 months ago, is we actually brought seniors in, and we had college kids, I think someone from this institution,
Long Beach State,
teaching seniors how to access the internet, how to use the computer to expand their world, to expand their lives.
Because they might be sitting there alone at home, and here's the whole world they can connect to if they knew how to do it.
And it's great to see the college kids just getting a lot out of it, and hopefully setting a stage where they get more involved in communities going forward. But really expanding the seniors.
I was at the Blast Breakfast a couple of weeks ago that helps at-risk kids or at-promise kids with mentors, including some from Long Beach State. And one of the mentors spoke, and the point was, it not only helps the mentee, it helps the mentor. They learn something about someone else, and that's valuable.
There's unique relationships that are established when humans come together.
Wow. On that very positive note, we'll pause and we'll be back with the rest of Straight Talk after these messages.
Phil Trainees mixes California style with continental cuisine that includes fresh seafood from around the world. Since Phil is the chef, the menu has a wide variety of pastas, salads, soups, and appetizers that feature his unique personal touch. And the Italian-American signature dishes are simply beyond delicious. You never know who you're going to run into at Trainees, from the famous sports legends on the Wall of Fame to local celebrities having a drink at the bar. For the best fine dining experience, visit Phil Trainees.
At Performance Plus Tire, you'll find we carry Toyo tires. For over 50 years, Toyo has been a world leader in the development of high-quality tires. Optimum performance, safety, and a comfortable ride. That's what makes Toyo tires great. And now come into Performance Plus Tire for a great deal on these Toyo tires. Proxys ST, Open Country AT, and Proxys 4. Toyo tires, driven to perform. Come in today and we'll install new Toyo tires on your vehicle while you wait. Performance Plus Tire on Cherry Avenue, 1 mile north of the 405 in Long Beach.
There's a world of opportunity available through the College of Continuing and Professional Education at Cal State Long Beach. Would you like to move ahead in the field of human resources and personnel management? Sign up for the Human Resources Management Certificate Program. You'll learn how to expand your knowledge and skills and advance in this dynamic industry. For more information, contact the College of Continuing and Professional Education at Cal State Long Beach.
You've been planning this moment for a long time. It couldn't be a more perfect moment. And you have the perfect ring that will tell her, I want to love you forever. But nothing is perfect.
Don't listen to that guy. He got the ring at McCarty's.
McCarty's makes a moment.
I think we should be very proud here in Long Beach to have an entity like Scan Health Plan as part of our community. An entity that was founded here, 30 plus years, still going strong, and even expanding its reach beyond its members, that helps Long Beach uniquely, but also other communities as well. So thank you, Chris, and all members of your team for what you do, and final words.
Well, we have a very proud history. We have a proud future. We're very, very pleased that we've tied Kaiser as far as the best satisfaction, but we have so many more programs we'll be implementing in later this year, 2015 and 16. I'm looking forward to coming back next year and sharing how we continue to drive more and more satisfaction, with our members.
Well, it's an exciting story, and we thank you for joining us here on this special edition of Straight Talk.
Thank you for having me.
You bet. And thank you at home for joining us. Please be with us next week for the next edition of our show. Good night, everyone.
Straight Talk has been brought to you by the Port of Long Beach, the Press Telegram, and Scan Health Plan. And remember, Straight Talk is viewable 24/7 at straighttalktv.com.
Maybe he's really focused.
Maybe he likes spinning the wheels.
Maybe he just loves trucks.
Preoccupation with objects is one early sign of autism. Learn the others today.
Okay, so we drowned the fire, stirred it, drowned it again, and now just feel if it's cold.
Yeah.
Cool.
Smokey just gave me a bear hug.
I know. I already posted it.